Good morning, and welcome back to Good Samaritan Facebook Live. My name is Dr. Scott Stine. I'm a family physician here in Vincennes, Indiana, and Chief Medical Officer of Good Samaritan Physician Network. With me, as always, Adam Thacker, who's one of our pharmacists slash experts in all things vaccine related, and Chief Operating Officer of Good Samaritan Hospital. He'll be taking all the hard drug questions today. We'll be giving you updates on COVID-19 in our community, a little bit on statistics, and then, of course, where we've been with vaccines, touch on the monoclonal antibody infusions that we have been using, and then a little outlook as to what's been happening in terms of opening up a bigger population as far as the vaccines are concerned. So to lead off with statistics, around 3,700 cases since we began, a little bit over a year ago. Most importantly, the numbers look more encouraging in terms of what those local numbers are as far as positivity rates. So the all positivity rate around 2.7%, and the unique individuals 5.4%, which has come down dramatically over the course of the past couple weeks. Still with around 30 active cases in the community, but we're seeing looking across the state as far as the number of blue counties that we've had, those are coming back down. All of our surrounding counties are blue. So really that speaks a lot to what we describe as far as that community transmission, where we're at with things and how that's changed just over the course of the past week or so.
Yeah, and as you mentioned, that color coding is a real quick and easy way to take a look at that map and see where we're at. And blue counties surrounding us really would anticipate Knox County going back into blue this week, barring any big uptick in cases. A number of those active cases, the 30 that we have, will be coming off of their quarantine state and being considered active this week. Again, barring any uptick, would see that going blue, which is where we want to be. That's that low, minimal transmission. We're certainly seeing that the same on the hospitalization side. Very few hospitalizations, although as we've talked about, it's a younger population that is now being hospitalized when they are contracting COVID, and most of that we're tying back to that's population that's had less uptake with getting vaccinated. So we really continue to wave that flag of if you haven't been vaccinated, we have next day availability in this clinic. There are clinics throughout the state, and really kudos to state of Indiana compared to many other states in availability to get vaccine. I mean, I feel comfortable in saying that across our state, in less than an hour's drive, you can get vaccinated. And that's not the case across the country. There are still some states that have vaccine, but in mass vaccination sites that are 2, 3, 4-hour drives and long waits and weeks to get appointments, and we're not seeing that. So convenience or availability are not an excuse to not getting vaccinated. And so then we turn to those populations, why or why not. And really it's about understanding the vaccine process and being comfortable with that and the risk benefit of getting the virus itself versus getting vaccinated. And certainly as we've seen it really unfold, the minimal side effects of getting vaccinated, much, much less than the effects of COVID virus itself and potentially long-term outcome of that.
And really, probably clinically, the most compelling thing I can tell people about in my experience over the course of the past month or so is, as you said, the majority of those patients that are getting sick with COVID now are in their 20s, 30s, 40s, 50s. And although we're not seeing that population get hospitalized, which is as we would expect it, the biggest issue and the most compelling reason to get vaccinated in that age range is just because of the length of the illness. Many of those patients that I have seen over the course of the past month or two have been sick and have been sick for weeks. Many of them being off work for 2, 3, 4, 5, even more weeks. And that affects their family members as well. Just as if we went back a year or so ago and we're talking about isolation and quarantine and what those time periods are, that's still affecting those families and the children of those families. And so it's still very important, not just for your own personal health and safety, but thinking about your coworkers and your colleagues and your children and what that's going to look like for them. So, we've all been vaccinated. We're looking forward to the day when enough people have been vaccinated that we see very little community transmission. We stay blue, and that's sustained. As Adam has spoken to in the past, we see these kind of upticks and down and up and down and up and down. And that really just speaks to the fact that we still have had enough critical mass of infected people within the community that continues to be spread.
Yeah, and it's not necessarily when we see those upticks that it's one event. It's which tells you that there is still that transmission across the community where those one-on-one interactions lead to another transmission, not just one large event where everybody was packed indoors and not wearing masks. And we saw some of that in the beginning because that is when it's most transmissible, when we're indoors, less ventilation, not wearing a mask. Those types of events are higher risk. But as we talk about in comparison to the flu, so for years and years we've talked about flu vaccine, and the effectiveness of flu vaccine has been 25 to 40%, give or take, depending on the year. And then we look at our COVID vaccine, a very similar side effect profile, yet we're seeing 90+% efficacy, which is just tremendous as we go forward in having that type of results against a virus and the vaccine. And if you are vaccinated for flu, for coronavirus, and you come in contact with the virus, it's about preventing that clinical illness, not necessarily preventing that the virus can enter your body and that you will be positive upon any type of test for that. But it's really about not getting clinically ill, ending up in the hospitalized, having very mild symptoms. So I've heard some also say, well, if I come in contact, I'm still going to get it. Well, the clinical illness of how you feel and the medical effect is going to be much, much less.
And it's still very important to realize that we have ample amounts of the monoclonal antibody. I get calls still every day, typically from people in surrounding communities that are wanting to come to us to get that monoclonal antibody infusion. And the nice thing is it's very easy to administer. It's very safe. The critical thing about it is you need to receive that monoclonal antibody as soon as possible when your symptoms start, when you have a positive test. So unfortunately, some of those patients that I was describing over the course of the past month or so that have become ill have waited into the second week or so to get evaluated and get tested. And unfortunately, the treatment really is not very efficacious during that time period. So the first few days of illness, we would like you to get with your primary care provider, get with our convenient care, get tested. Those results come back nearly immediately, and then we can get you lined up to get the antibody infusion, because again, that's a major game changer in terms of how many days you're going to be sick and have to convalesce. That can be a difference between 21 days versus 3 days. So it's incredible.
Sure.
Looking at kind of where we're going with vaccine. So as you said, next day availability on vaccine. People from outside the state can come into Indiana to get vaccine here, which is huge for the states that have had bigger challenges.
Yeah, and here at Good Samaritan, we have had the Pfizer vaccine. There are the 3 vaccines that are approved in the United States: Pfizer, Moderna, and Johnson & Johnson. We have had the Pfizer vaccine since the beginning. We've talked about it many times. Ultra cold storage is really why hospitals across the state have predominantly been Pfizer. Your health departments more Moderna because of storage, and Johnson & Johnson, which came on later and less availability, but have had those to be able to go out into outreach types of settings. And it's important that instead of just talking vaccine, that we kind of qualify based off of the manufacturer, because what's coming next is expected as early as this week, maybe next week. We do expect the FDA to give emergency use authorization for the Pfizer vaccine for ages 12 to 15. So currently Pfizer is approved for 16 years of age and older. The other 2, Moderna and Johnson, start at 18. But we expect Pfizer to move to the 12 to 15 population. Obviously, that's an adolescent population. Parental consent and guidance will need to be there for being vaccinated. We plan upon that approval happening to set up individual focused clinics with time frames in the evening where parent and 12 to 15-year-old that wants to be vaccinated can come to the hospital, be vaccinated. We'll be at the same site, same process, but just kind of identifying that population being a younger population will need to be accompanied with a parent and go through the process that way.
And really, this is our second effort at getting that vaccine out to the younger population. We went through a series of vaccinations where we actually went out to the schools,
Right.
offered that up. Now, that has been in the older age range of our adolescents, but this is going to be opening up to a younger population. And while that population isn't necessarily as inclined to become as clinically ill, the biggest issue that we have seen parents and kids alike interested in is it keeps you from having to quarantine. So once you are fully vaccinated, if you have an exposure or somebody that you're around that is positive or has been ill, you are not required then to go into that quarantine period.
Right. Yeah, so the what's in it for me for
Right.
the 12 to 15-year-old is that get vaccinated, do not have to be quarantined, miss events, activities, those types. The other what's in it for me is the safety of your family, because as we well know, anyone around kids, they are wonderful vessels for carrying viruses from person to person, and they many times have little clinical impact, but can continue that transmission going. So we want to be able to shut that down, and staying up to date with the vaccine program is the way to do that. Pfizer's data they shared for the clinical research, same dose as adult, and showed very similar side effect profile, same efficacy at 99%. So really just tremendous results, and something that I think continues to move us forward in reaching that magical herd immunity type of number where transmission really shuts down.
Yeah. And that's really what we're shooting for here. The higher percentage of our population that we can get vaccinated, including the younger population, reduces that transmission, gets us closer to herd immunity, and that basically draws things to a close. Now, people, of course, are asking, where we are now versus where we're going to be at the beginning of school year or in the middle of our cold and flu season next year, and what that's going to look like. So, as we've talked about before, we're very fortunate. We've worked well with our local schools, with our local health department to keep schools open throughout the majority of this past year, which is truly remarkable when you look at what other communities have had to go through. And that's certainly what we're shooting for into the next year. That being said, there are discussions out there as far as what would be booster shots, what's going to happen in the future. And really there's still a lot of research going on in that realm. We have other vaccines that us adults get that have required boosters in the past. A good example of that would be the old shingles vaccine. There's a shot and then a booster after that. Obviously, flu vaccine gets a booster every year of a different viral type. We see that with the pneumonia vaccine. So it's certainly not unusual to think that would be the case with this as well.
Right, that's where most of the scientific research is really trending towards, is very parallel to what we see with how flu vaccinations have evolved. Really see towards the second half of this year two pretty significant developments. The first is there's anticipated full FDA approval, so moving out of the emergency use authorization status, if you will, for vaccines, and moving to full FDA approval. When you look at from a stepwise approach, what has to happen, there has to be phase 1, 2, and 3 clinical trials. Those have happened. Yep. The data has to be submitted to the FDA. That is ongoing and happening. So it's anticipated by late summer, early fall. No dates have been set, that there will be a full FDA approval given to the 3 vaccines that are currently being used in the state under emergency use. So what does that mean? Really what that means is that we'll start to see CDC recommendations, employer recommendations of mandatory requirements to work in certain types of environments, healthcare and such, where there's higher risk, and that all is yet to be determined. And then the other information that's coming out is that we're seeing that Moderna and Pfizer, I actually haven't seen Johnson & Johnson, but I would suppose that they're probably doing the same thing. Pfizer and Moderna have already started testing booster shots. And again, following the flu, an annual booster shot may be in the future. It may not. This is new technology, and we're kind of figuring that piece out. But that 6 to 12 month after the first 2-dose regimen, it's been identified that antibody titers do tend to fall off, that the efficacy starts to dip below 90%, which is still tremendous.
Right.
So where we end up with, whether it's an annual shot or further down the road, a 5-year shot, it also, the other piece of it that's completely unpredictable is the idea of new strains and developments and what that means. That impacts efficacy to a great deal. But we do anticipate the Good Samaritan mass vaccination clinic, even though uptake, we've really went from 400 plus vaccines a day to less than 100 a day. We do anticipate by the end of 2021 that we're probably ramping back up to those booster shots, and we'll be able to provide that in the same capacity that we were earlier this year.
Sure, and just to help people understand, this is common with all of our vaccines. When we look at pneumonia vaccine and the time that I've been a physician over 20 years, and you as a pharmacist, we've seen a myriad of different recommendations on pneumonia vaccine. From get vaccinated with pneumonia vaccine at 65, and then once every 6 to 10 years afterwards, to one at 65 a year later, and then never again. This is an evolving process, and we will continue to see the same thing when we look at the COVID vaccine as more research comes in. So we will keep you up to date on how things are looking with that. But that has been a hot question on people's minds: is are we done? And if we're not done, are we going to be boosted? And the likelihood is we will, but we'll know more about that as we go through the next several months. Any other big topics to hit before we move on to the phones?
I think just a reminder, we talk about COVID every week, and it's still a very hot topic, and the state of emergency in Indiana is still in effect and still across the nation. But diabetes, heart failure, cancer care still needs to happen timely. All of our services are open. It's a very safe environment, not just in Good Samaritan, but hospitals across the state are very committed to safety, whether that be masking, additional hand hygiene, all of those steps that are being put into place to keep everyone safe. So don't put off much needed medical care. Don't even put off annual wellness care. Now is the time to get back into your primary care physician, or if you put off a specialty visit that your primary care physician had referred you to, now is the time to get back into those settings, get evaluated, test, whatever may need to be done, just to make sure that your health is a priority and that we're staying on top of that.
Yeah, and there's no question that a lot of people have postponed a lot of those things,
Right.
not just elective procedures, but as Adam said, a lot of wellness type things in terms of your wellness visits, your vaccinations, PAP, breast exam, mammogram, colonoscopy, all those types of things people are catching up on right now. I've cleared more people for hip, knee, and shoulder surgery in the course of the past month than I think I normally would in several months. So a lot of people are getting back in to get that stuff scheduled, and this is an ideal time. We know that now that critical mass of individuals that are out with the illness is smaller, our numbers are looking better. This is a good time to re-engage in that. So we would encourage people to get back in and get your health care up to date, and we can get you caught up on everything. Tiffany, anything from the phone side?
Do we have any idea how many people in Knox County are fully vaccinated?
So I don't know that I could give an exact number that are fully vaccinated, but we have given, between Good Samaritan Vaccine Clinic and Knox County Vaccine Clinic, we've given over 30,000 vaccinations. Now that can pull from other counties, of course, but we do anticipate that the largest percentage is from Knox County. You can actually go on the ISDH, State Department of Health website, and there's a vaccine dashboard, and it will show fully vaccinated by county. And it shows our county, I didn't look at the updated numbers today, but last week was in the 14,000 range. But there's a pretty significant lag in that data getting reported and how that has to come back and go through the system. So I think it's a significantly higher number than what is actually on that dashboard. And the state has indicated that there's a pretty significant lag to that. But we know that we've given over 30,000 vaccines within the county clinics, but those can be for other populations as well.
Now you talked about, maybe this week hearing if there's approval for 12 to 15-year-olds. Are there any studies being done for children younger than 12 to possibly, maybe that's going to be something in the future happening, that those school-age children would need to be vaccinated?
I know that the manufacturers that we spoke of, Pfizer and Moderna in particular, have indicated moving below age 12 as well. That will take more time because the 12 to 15 adolescent population is being studied with the same dose, which indicates the same data as what is being utilized in those adult approved populations. Once you get below 12, they're studying half doses, quarter doses, those types of changes. So it's going to take longer. And as we've seen, kind of reverse of flu, our oldest population working our way down has been at the lowest risk. So they're doing it in a stepwise fashion. I do fully anticipate that those populations will be studied and there will be data to come out and there will be recommendations on vaccinations, but there's no timeline for that at any point really in 2021 that I know of.
Okay, that looks like all the questions.
All right. Thank you all very much for joining us. We'll be with you again and give you updated numbers and stats on where we're at in our community. Thank you.